end of the day means that we learn more from this experience on a global nature or global perspective in terms of global health ultimately. And all of this has just led me to the simple fact that I'm really glad that I started the World Health Organization weekly press briefings 3 months ago or 3.5 months ago at the announcement of our declared national or declared state of national disaster. And hopefully the message did go out and reach people. I really wish it had just reached more people and we were able to disseminate this information on a much wider basis. And the reason I say that is because, quite frankly, when we look at the global figures, we've had 1 million new cases reported in the last 4 days globally. 1 million new cases. That's 250,000 a day of new cases that have been reported. Now, from the time that we clocked over to 16 million, we are currently sitting at 16,100,905. So it looks like we're going to go for another 250,000 new cases in the last 24-hour period. In essence, this means that in the last week, we are close on 2 million infections globally, with a global mortality of 645,482. If we carry on like this, definitely by December, the world would have lost 1 million people due to COVID-19, whether that be directly or indirectly. Because at the moment, nobody is able to categorically stipulate that the ailments the world population are experiencing and the cause of death is or is not related to COVID-19. There is just not enough statistical data. Let me clear the timeout timer. Okay, ZS6 OPS returning. There is just not sufficient data to categorically stipulate what is and what is not the cause of the deaths and the ailments. And we know that with regards to the Spanish flu of 1918 to 1919, the estimate is between 50 and 100 million that lost their lives globally. And I've always questioned, why is there such a massive difference on an estimate of 50 to 100? One, statistical data was not kept, or data wasn't kept. Statistically, they haven't got anything to go back on. It's an estimate. A lot of the results, the post-mortems, pathology reports could be skewed. So one doesn't really know where we stand. And that is the scary part about a pandemic. An epidemic, if it is just within your own country, but more so as a pandemic. Now, Margie, and if Rob was up tonight, and if John was up tonight, will know. These are the discussions that we had with Red Cross. It was part of our planning. And how do we plan? How do we move forward? How do you treat? How do you take care of? How do you deal with the remains of those who have lost their lives? I'm questioning at the moment why it is there are so many countries on international news. We are not seeing it on South African national news. And if we are, I might be missing it. Because in all honesty, I don't watch a lot of national news. But I'm questioning why it is that so many countries, South American countries in particular, that there are bodies that are found in the streets. Why are they not in hospitals, in homes, in houses, in businesses? And when we look at the socio-economic aspects of South America and compare that to Africa, there are many, many, many areas in South America that are very, very similar. Let me clear, time out. Guys, ZS6 IPS returning. There are many, many areas of South America where the socio-economic conditions are very similar to those in Africa. And if you take a look at our South America, Brazil in particular, 2.3 million confirmed cases. Well, they're only 3 above South Africa. They're second highest worldwide. We are 5th highest. I don't know if you guys are aware of that. Most people say, yeah, but you know, these are things we shouldn't discuss. I'm sorry, people, these are things we should discuss. This is a part of emergency communications. This country, this world is in dire straits at this moment in time, regardless of the conspiracy theorists, the possibilities, and all the rest of it. Too many people are losing their lives for unexplained reasons. Too many people are ending up in hospital unexpectedly, suddenly, and are finding themselves in critical conditions. There's always been a possibility that each and every single individual on this planet can end up in a hospital for one reason or another. 99% of the time, you know it's coming. But at the moment, the numbers are sitting much higher on that 1% of the population that suddenly find themselves in hospitals. The hospitals are inundated. They are on divert virtually all day, every day throughout the country. Which is why, be safe, be careful, order online. And that actually leads me to one of the questions I put out amongst the CERT volunteers during the course of the week with regards to Regulation 19 health of the health regulations as it was amended a week ago. And my question to everybody was quite simply, give me your thoughts on this. And I don't want emotional thoughts. And what I'd like to point out is when we're looking at a pandemic, a disaster, an emergency, or anything along those lines, when it comes to emergency communications, our focus needs to be zoned in correctly. All right, ZS6 IPS returning for the timeout timer. Okay, so whenever we read something or hear something that is related to disasters and emergencies, and we need to communicate, our communication has to be clear and accurate and direct and spot on. But the one thing that I have never discussed in the last 4 years is our interpretation of what we hear and our interpretation of what we read. It is as vital as what we say, if not more important. Because if we don't read correctly, our context is distorted. Therefore, our response is inadequate or incorrect or completely out of sync and irrelevant. And to be quite honest, that is normally the case. our response becomes irrelevant. As radio amateurs, we could be called upon to transmit messages from point A to point B. It is one of the functional roles of amateur radio worldwide. And for those that don't believe it, maybe you should go and have a look at the constitutions and go and have a look at world history and have a look at why there are emergency groups that operate on radio amateur. And it's not just league members and everything else, other organizations. Go and do a proper Google search on the American Red Cross and amateur radio. And guys, you will be utterly surprised to learn that the American Red Cross has an emergency communications network of their own accord, which they can deploy worldwide, specifically on amateur bands. Which is why it brings me to the point of reading and interpreting. Okay, ZS6 IPS returning. Why it is so important to interpret messages correctly. Messages can be transferred between two locations in the written format, in the verbal format. The verbal format can be done on a one-to-one basis over technology, over radio, over satellite, over anything you want. There could be many ways of getting the message across. You might get the message right, but the interpretation is wrong. Another form of messaging, as we are looking at things today in South Africa, is through the regulations. True, many of the regulations don't make sense. And the interpretation of many of the regulations is actually taken incorrectly. And this is why I specifically, on the health regulations, looked at Regulation 19, which referred to, in order to qualify for self-quarantine or self-isolation, the applicant must have the following. And then they've stipulated the requirements for self-quarantine, like a separate, well-ventilated bedroom with a bathroom and toilet, or a residence that is not shared with persons who are not subject to the quarantine. That meals served in the room are to be done in disposable utensils, or utensils that are separate and are washed properly. If there are persons who are not subject to quarantine. So what I wanted each and every single one of the guys to do is to have a look at these clauses, and without being emotional, saying, okay, well, 19.1a says that you should be in a residence where there are no other people who are not subject to the quarantine. And then 19.1b says you've got to do it this way if you've got those people that are not subject to quarantine within the premises. So don't be emotional about it, but consider both of the factors. Okay, ZS6 IPS returning. So what I'm trying to get at is, when we read messages, our interpretation of the messages needs to be correctly done and analyzed and considered. And if it is a given instruction, what do we do with that instruction? If A, we don't understand it, and B, if we do understand the instruction, or C, we think we understand the instruction. Ordinary messages sent between MCOM operators should always be read back so that you confirm you have taken down what was given to you. Point number one. Point number two. Always confirm your interpretation with the sender. In the case of regulations, we can't do that. But that is still a form of communication. So if you're looking at 19.1a verse 19.1b, you as a person who is ultimately there of your own accord, of your own desire, of your own willingness to provide assistance to others, you should be looking at ways and means of determining how can you assist somebody else in relation to those particular regulations. In other words, start formulating a plan. If not for people around you, how about your own immediate families, guys? Has any one of you that is listening to me tonight actually sat down with your family members and discussed, prepared or organized a plan of action within your own household in the event one or more of you are infected with COVID-19? Z6OPS returning. You know that famous saying, charity starts at home? You cannot assist anybody else if you cannot assist yourself. Your safety always comes first. That is a top priority. Don't get me wrong. But there are still people out there who are willing and prepared to step over that threshold and to go out and to provide assistance as safely as they possibly can, such as healthcare workers and other volunteers and community-based organizations and people within communities. But the point that I wanted to make on 19.1 and 19.2 was for each and every single one of you to sit back and to analyze that document or that regulation and to formulate a plan of action where you can provide assistance to somebody else. The person sitting next to you or in the room next door to you or in the lounge or on your property, your family, that is somebody else. Again, I ask you, and you know, it's not something I expect an answer from you. I'm not asking so that you could be ridiculed or become part of this overall stigma that seems to have crept in and always creeps in when we've got pandemics and epidemics and diseases and various other things in our lives. That's not the point. The point is for you as a listener on this platform tonight and the other platforms that I utilize to prepare you to be able to assist somebody else. What is your plan? Think about that for a minute. If your family members are infected, are you going to be able to comply with 19.1? ZS6OPS returning? Or are you going to find yourself in a position, and 99.9% of the cases that are hospitalized may not have visitors of any kind whatsoever? Oh, by the way, for those of you that don't know it, there is virtually 99.9% of the chance and possibility that last week, Friday, on the 17th of July, my own brother lost his life to COVID-19. Or COVID-19 related that has now aggravated his underlying conditions. Here's a thought for you. Tonight is wake-up time. Wake-up call for many, I hope. Any person who gets admitted to hospital within your own family, you might not be able to see them. Ask yourself, how are you going to be able to deal with that psychologically, knowing that they are in the hospital and you can't be with them? Guys, this has got to be taken seriously. What happens if they lose their life in that hospital and you cannot see them? Are you aware of the fact that at the end of the day, the health regulations stipulate that all persons who lose their life must be buried within 7 days? There's chances that you might not even be able to make it to the funeral. So guys, seriously, we need to have a good look at how we interpret messaging and why it is so important to have a proper interpretation, like I have demonstrated tonight. That regulation is for you to sit back and to formulate a plan to ensure that your family is safe, your loved ones are safe, to reach out. ZS6OPS returning. To reach out and to assist your family, your friends, your neighbors, if and when they are affected in whatever format. We've got to take COVID-19 very seriously, especially now. The next 2 to 3 months is going to be an absolute game changer. This is where all the projections are taking us into extremely high confirmed and mortality figures, estimates. So please, people, be careful out there. Those of you that didn't respond, maybe come back and give me some other ideas. Relook what you can and cannot do. And give me some answers. And share your thoughts on the group with the guys. Let's discuss it. And let us try at the end of the day to be supportive of each other. To provide a lending hand, to assist. To be ready to reach out. In whichever format or way that we can. Seriously, if you're going to the spa to get a loaf of bread, shout at your neighbor and ask them if they need any bread. If it means you need to buy them a bottle of hand sanitizer that they can sanitize the outside of the bread that you put on the wall, help them. Because tomorrow you might find they're no longer there. All right, so I've got a few minutes left on Zoom. Let's just quickly find out if, anybody would like to add themselves to the bottom of the list tonight. And then after that, if there's no new call-ins, I'll just find out if anybody wants to pass any comments or ask any questions quickly. So ZS6OPS standing by for any other call signs. Okay, there we go. Good evening, Stefan. Welcome. Okay, good stuff. Anybody got any questions? Please go ahead now. ZS6OPS. Okay, nothing else heard. Anybody want to pass any comments? Anything at all, guys? Last call. Otherwise, I'm going to close the net down. ZS6OPS. All right, nothing else heard. On that note, thanks everybody for calling in. Those that sat and listened, please, guys, you're more than welcome to give a call sign. Let us at least know you are out there. We know there's a lot of people that are listening, which is not a problem. We got nothing to hide at all. And of course, all this is intended to be beneficial to all the listeners. And if it's not beneficial to you personally, perhaps you can pass some of the information on to others, and maybe it'll benefit them. And ultimately, at the end of the day, the saving of one life is the crucial part of my mission in life, if I can put it to you that way. So I'd like to thank you all for calling in. Just a reminder, I run this net every now Sunday at 1900 for approximately an hour, usually for check-ins, other times for meet and greet, a little bit of socializing, or alternatively, we may do some training or have a discussion topic as we had tonight. Anybody with topics are more than welcome to discuss it with me, and we can slot you in and give my voice box a bit of a break and a breather for a Sunday night. I must admit that by the time I get to a Monday morning, I need a weekend after Sunday nights. So on that note, again, please be very careful out there. Social distancing, guaranteed, keep it up. Number two, try and do your shopping online. Avoid the shopping centers. Avoid large gatherings, crowds. Otherwise, I know restaurants and things like that might be open. If you do go out, be extremely careful. Wear your masks. And, of course, wash your hands on a regular basis. And Rory and Adrian in particular will be able to bear me out on this statement. I'm like a cat. When I do my hands, I do my face at the same time. And then, of course, I burn the living daylights out of my eyeballs. But anyway, be safe, be prepared, and, of course, be happy. This is ZS6OPS releasing 145.625 for general use. Cheers all. So I wonder who I pissed off this week.
What happened?
Every time I key the mic, I piss somebody off, Battis. Are you still a member of the West Rand Club?
No, I haven't paid my stuff. I still need to inform them, but I don't think I'm going to be part of them anymore.
No, dude, I'm not advocating anybody stays a part of them or the South African Radio League. I think, in all honesty, if each and every single one of us concentrates a little bit more on the public benefit organizations, CERT, one, you know, you guys will actually have a fair bit more time because you don't have club activities and CERT activities. And CERT really is just that hour on a Sunday night and, you know, respond to emails during the week or SMSs or WhatsApp or whatever. We don't have to go out and run around, eh?
Now, I must say to you, ThinkBike is keeping me busy. Even though we have had nothing events for this time period. It still keep me busy. All the finances, all the meetings that we had to organize